let's do our regular route and run on here.
So about 4 miles.
4 miles.
Awesome. My name is Cindy. I'm 33 years old, and I'm going to see Dr. Alter for labia clitoral hood reduction. I love living a healthy lifestyle, and I work out all the time. I compete in bodybuilding and figure, and I also own a juice bar.
We've got Power Pro, which has 37 grams of protein.
Sometimes I do feel embarrassed because I do wear tight, form-fitted clothes to work out in.
What are you making, Cindy?
I'm making Vietnamese curry.
I thought curry was from India.
It's also Vietnamese, too. I'm a Vietnamese refugee. I came to the U.S. with my family when I was 5 years old.
When did you come here, Cindy?
1980.
Okay.
And
On a boat?
we did.
She
We were
most really did.
a refugee for a few years. And we came to the U.S. in 1980, December 20th. They wanted to learn English, and my parents worked out in the fields, worked their butt off. My dad has his own company now. I think the weirdest experience on the boat that I can remember,
Scary.
because I was 5, I just remember seeing what's called the Thailand pirates, or hijackers. They took a lot of the food, a lot of the jewelry and money, and then the second time, they were able to get all of our water.
Sounds very similar to my upbringing in Orange County, minus the boat. Just kidding.
Coming to America gave me lots of opportunities, owning a juice bar, competing in bodybuilding and figure, and also having the surgery as well.
Hi, Cindy.
Hi,
Nice to meet you.
nice to meet you too.
Please pull up a chair. So you're here for your inner lips.
When I first found out there was a procedure to correct the large labia, I was ecstatic.
Do you feel that you don't like the appearance, or?
More of the uncomfortableness of having it there.
It also says here that you have an issue with your clitoral hood.
Yes, I do.
Okay, what, is that a discomfort issue or a cosmetic issue?
Both as well. It's uncomfortable, and also it just hangs real low.
In other words, you see the clitoral hood between the outer lips. Is that what you mean?
Yes.
Okay.
Yes.
What we're gonna do is we're gonna go in the other room. Cindy is here today because she complains of discomfort of her labia minora and her clitoral hood. Okay, now lie back. Excellent. While examining Cindy, I see that her inner lips are rather large and her clitoral hood is protruding quite a bit outside the labia majora. Well, this is her labia before, and what I'm gonna do is take a V out and then suture it like this so that they're shorter. And her clitoral hood is very long, and that whole area sticks out quite a bit. So afterwards, we have a suture line going crossways inside and then on the outside, but it's much shorter and it doesn't stick out very much. This will give her relief both cosmetically and functionally. Okay, Cindy, so what I'm gonna do on you is I am gonna reduce the size of your clitoral hood. I will reduce the size of each of your labia. You will not be able to work out for about a month. No sex for 6 weeks. Tougher on your boyfriend than on you, okay? But it's not that painful an operation.
I think after the surgery, sex is gonna be great with my boyfriend, Jeff, because I no longer have to stop and adjust myself. Okay,
So we're all set, okay?
okay,
And I will see you soon.
okay. Thank
Okay.
you. It'll be okay.
They're just gonna do a local, and they're gonna give you like a Valium or something. But she'll still be out.
So you'll be awake for the procedure?
No.
She'll be out, trust me. She drinks one wine cooler and she's out. So a Valium will totally knock her out.
Today's the day of my surgery. I'm having the labia reduction surgery and a clitoral hood reduction. I'm not nervous about the surgery itself, but I am nervous about being under anesthesia.
You said last time you had surgery, you had a very bad reaction to the anesthetics, right?
Doctors have said that because of genetics, my body doesn't have a tolerance to anesthesia. I've had problems in the past.
So what we'll do is that I'll give you enough medication in your vein that you'll be nice and relaxed and sleep for the whole thing, but there's no need for a general anesthetic.
The only concern with Cindy is that she had problems with anesthesia. So we're gonna do her under sedation, and I'm confident that Dr. Tarani will do a good job.
Okay, here's the medicine I promised you, okay? So it's gonna make you very nice and relaxed and sleepy.
Oh yeah, I feel it now.
You feel it now already,
Okay,
huh?
good night.
Good, let's go. All right, good. Comfortable?
Yeah.
Just nicely relax. So that's how you're gonna be for the rest of the surgery, okay?
Today is Cindy's surgery. I'm going to reduce her clitoral hood. I'm going to push in her clitoris, and I'm going to reduce her inner lips or labia minora. Okay, so we're ready to start the clitoropexy, which means to move the location of the clitoris with a clitoral hood reduction. So I'm making the incision in the clitoral hood, and her clitoris is actually normal in size. But what makes her a little bit different is just that the clitoral hood is long, and the clitoris just kind of hangs down. For women who have large clitoral hoods, when they stand up, the clitoris and the clitoral hood just sticks out. It makes it feel like they're a little bit of a penis there. Just releasing the attachments of the clitoral hood to the clitoris. I'm moving the clitoris in closer to the pubic bone with a couple stitches so that I'm not going to cause any damage to any nerves. Snap, please. I have shortened her clitoral hood, and her clitoris is not going to stick out very far anymore.
Dr. Alter, she's under an IV sedation. She's not under general, so anytime you're ready to go into a new area where she's not numb, please let me know so I can give her more sedation, okay?
You got it, Doc. I'm going to now do the labia reduction. So I'm just making my markings now for the reduction of her labia.
Measure twice, cut once.
No, measure 3 times, cut once. Prior to my inventing this technique in the mid-90s, if a woman complained of large labia, the doctor would just take a clamp or a scissors and just cut them off. I've just cut the V out of the right labium, and now I am suturing the top part to the bottom part. I've finished both labia. Now I'm just closing the side of the clitoral hood, and then we'll be done with the surgery. So this is the final stitch, and I have reduced her clitoral hood, and I've reduced the size of her inner lips or labia minora. Marked difference. All done.
Don't move, sweetie, okay?
Cindy, we're all done, okay? We're all done with surgery. You're just waking up, okay? You don't have to talk, okay? But everything went very, very well, okay?
Coming out of anesthesia was very strange. I'm shocked that she did not wake up very quickly.
She looks out.
Is she okay?
She's taken a really long time for the anesthesia to wear off. Cindy. Cindy, wake up.
I'm a little concerned. This is a very unusual situation.
Cindy. Huh? Don't cry. No reason to cry.
Cindy coming out of anesthesia was very strange. I mean, I was very shocked that she did not wake up very quickly, especially with the drugs she was given.
We are all trying so hard.
Jack.
She was given sedation by a fast-acting drug that should be eliminated by the body very quickly. She doesn't handle drugs very well.
Can you move? There you go. Stay awake. There you go. There you go. That's what I'm talking about.
She'll be okay. I knew she was real sensitive to anesthesia, so I knew it was gonna take a long time, so we're just gonna have to coax her into waking up.
Cindy, look at me. Surgery went great. Everything went fine. Okay?
Keep your head up. Keep your head up. You got it. There you go.
I'm here, okay? Woo!
Lights are on, but no one's home.
Yeah.
You okay, baby?
You all right? Okay. Well, everything's wonderful, okay, hon? I was a little concerned, but when Dr. Trani assured me that everything was fine,
She's stable. There's no problems whatsoever. She could stay like this till tomorrow. She could just sleep it off.
I knew everything would be okay, but it was a very unusual situation. Okay, Cindy, everything's good. Okay? Hug. Okay. I'll get the door for you. Yes, nurse.
She's holding her head up.
Cindy,
Hi.
you look great.
Thank you.
Sitting a little weird, but you look great. Wasn't that bad?
No, not at all. I'm here today for my post-op with Dr. Alter, and he's basically gonna tell me how I'm healing, see how it looks.
I talked to you the day after and you sounded good, but my gosh, I can't believe it. I called Cindy the day after surgery to make sure that she was awake and alert from her operation because she certainly left here in a very drowsy state. You should have been up and around in 5-10 minutes. And you were out.
I was trying my hardest to open my eyes. I wasn't surprised at all with how I handled the anesthesia. I felt like I was in a coma.
Well, let me see how you're doing here. Okay. Well, you swelled a little bit, but not bad.
Yeah, not bad.
Now, your right side swelled up a little bit more than the left. Don't even worry about that, because that'll go down. And you look absolutely great. Because Cindy is a bodybuilder, I'm concerned that she'll cheat a little bit and maybe try to work out sooner than she should. So I had to pound in her that she's not to do any sports for a month. No working out, weights, anything for a month. You can do some mild walking, but that's about it.
Okay.
I want to make sure she's going to heal well without any problems. You did great.
Thank you.
Okay, it's good to see you awake, okay?
Thank you.
Okay, Cindy. I'm at zero gravity in Florida, and I'm gonna go on a weightlessness flight.
Getting ready to go on the zero-G plane. Ron, are we ready to conquer?
Let's go, dude.
Let's do it.
I have a friend who is a part owner of Zero Gravity, and he said to me, this will be a life-changing experience, and I want to give this to you as a gift. And who better to bring on a weightlessness flight than my best friend, Ron? Zero gravity is when we get into a large plane. The plane goes into a climb, it hits the peak, and then it goes into a fall at the rate that it negates gravity. So during that time, you're weightless, floating just like the astronauts in space.
Yeah, we feel it going up now. Feeling a lot of G's forces. So that just means we're getting ready to be weightless.
0 to 4.
I can't believe it.
The feeling of weightlessness is just incredible.
Doing great. Scraping upside down.
When I was a kid, I wanted to be a fighter pilot, and I certainly wanted to be an astronaut too. But I guess this is the closest I'll ever get. But who knows, maybe in the future, I'll be able to go up in space.
Woo! Woo! It's great. It's great to be up in space, but it's even better to be back home.
It sure is.
Ciao.
Even though it's been 2 months after the surgery, and I'm 100% recovered.
So how much is this?
600.
You go, girl.
Now, when I go to the gym, I can just wear what I want and not be uncomfortable. After the surgery, even though I was supposed to rest, I didn't really abide by that. I went to the gym after 2 weeks because I was just going crazy.
So when you eat in Vietnam, does the food look like this?
Pretty much.
Oh.
I feel really lucky having the opportunity to come to America and to have the lifestyle that I have now. I like this place.
Pull apart. There you go. What are the benefits for you after Cindy's surgery done?
You know what? Just the fact that she's happier with herself obviously trickles down to everybody she deals with. I think it was just mainly her was her thing with her own self-image, you know.